Welcome to this edition of Pulse on Health. I'm your host, Mark LeMay. Sports medicine is a branch of medicine that deals with physical fitness and the treatment and prevention of injuries related to sports and exercise. Recently, sports medicine has emerged as its own distinct field of healthcare and is now a recognized medical specialty. Dr. Warren Bodine is the director of sports medicine at GLFHC. He joins us on this edition of Pulse on Health. Welcome, Doc.
Thanks, Mark. Thanks for having me.
First off, can you give a better explanation of what sports medicine is than I did in my intro?
No, I think you did a really nice job there. It's a question I get frequently from not only colleagues, family members, but more often than not patients. When I see them in the clinical setting, they always feel like maybe they shouldn't be in my office. Maybe they shouldn't be there because they're not an athlete. So I think we need to take a step back and just think about what sports medicine is. So sports medicine is really a branch of medicine that's for active people and for patients with some form of musculoskeletal condition. So it could be something that's genetic, it could be something acquired as a result of an injury. And if you think of it that way, there's more of a wide net that you can capture your patients in as a result of that. And it's a wonderful branch of medicine. If you think more about what I do and a lot of my colleagues do at the health center, it's considered primary care sports medicine. So I think people think of sports medicine that you're an orthopedic surgeon, you're in the operating room, you're taking the patient from the sideline through the operating room, through their recovery. Primary care sports medicine is a branch of medicine that engages with the rest of the healthcare team to take care of athletes or patients with some form of musculoskeletal injury. So primary care sports medicine is unique in that it has the perspective to know how to deal with an acute injury, know how to deal with the primary care side of treating those patients, and has some unique insight into some of the rehabilitation and some of the non-musculoskeletal aspects of sports medicine, including nutrition, psychology, behavioral health.
So if you're not playing a sport currently, you may need to see a sports medicine specialist as a result of some maybe older injuries you got when you were playing sports at a younger age. How do I know if I should come see you for that old football injury I got 30 years ago?
Well, it depends on how you're feeling, right? And I think that even myself, having eclipsed the 40-year mark, things hurt a little bit more than they used to a couple of years back. So I can definitely empathize with a lot of the patients that I see. And I think it's important to just know that you want to listen to your body. And your body is, if you're feeling pain, discomfort, stiffness, that's a way of your body telling you that something's up and you should probably get it checked out. I'm a firm believer of people engaging with the health system sooner rather than later. But I realize that's not a luxury for everyone, depending on where they are in their economical situation, job situation. They may not even have time to come to the doctor. So it's important to just know that, we at the health center and a lot of my colleagues, I think will echo this, that we're there to meet our patients where they are when they decide that they want to engage with us so that we can help them achieve their health goals.
How can someone determine if they are at risk for a sports injury?
It's another great question. I think that, again, I'll fall back on my listening to your body scenario. I think that folks can get injuries from something innocuous as tripping over something in their household, tripping over their dog. And it could be as a result of a motor vehicle accident. It could be the result of them playing a sport or an activity on the weekend, maybe playing with their kids. So determining a risk for an injury really comes down to what your baseline fitness level is. So, today, I have an injury in my left hip. I'm probably not going to go run out on a 10-mile run. I could probably do it, but I probably won't like myself tomorrow morning. So, I think people have to realize they have to know and acknowledge and embrace where they are currently in their physical fitness level, and they can push themselves a little bit further, but not to an extreme. So, adding on 10, 15% of what their workload is for whatever activity that is. So if they walked a mile for the last week, maybe they can go up to 1.25 miles. So if you think about that, like on a high school track or in a setting like that, that's 4 laps around for a mile. And then maybe next week you can go up to 5 laps and see how you feel, but maybe not go up to 10 laps next week. So you want to gradually increase your level of activity so your body can acclimate. So in terms of the risk, so again, to get back to your original question, how do you determine risk for injury? It comes down to where you are to start, and then incrementally increasing your physical fitness level.
I'm going to guess there are 2 times a year sports medicine docs get an influx of patients. I'm going to say the first of the year in like January, February, because everybody has the New Year's resolutions and they want to get into shape, but they haven't exercised in months or years. I wonder who that is. And spring and summer, because now the weather is nice. Everybody wants to get outside. Everybody starts working out or exercising, and suddenly you get injured. Am I correct about that timeline?
Yeah. Yeah, I mean, I think you hit the nail on the head there, Mark. I think that we do see an influx with specific changes in our society, right? So the New Year's, I mean, and if you're a fan of the New Year's celebration in Times Square, for the last couple of years, it's been sponsored by a major gym chain, Planet Fitness, who I also have to mention is not sponsoring me in any way, shape, or form during the course of this interview. So I just want to make sure I give any disclosures out there. But if you think about it, that company has embraced the New Year resolution mentality of knowing, hey, our society goes through the holidays, they have less activity, they're more engaged with social activities with friends, family, colleagues at work that usually involve eating and indulging with sweets and alcohol. And in the wintertime in our neck of the woods, it's a little bit less pleasant with the weather. So it decreases the opportunity to do things in the outdoor space arena. So we do see an influx of patients that may start to engage in physical activity without the appropriate guidance or listening to their body. And as we come into the spring and summertime, and again, this year being particularly unique with coming out of the pandemic, we have folks that are getting back to some form of normal. And with that, it involves going outside, maybe exercising, people feeling a little bit more safe to do that, feeling more safe to congregate with others and engage in those levels of physical activity. So I can confidently say we have seen an increase of what I would consider an overuse injury pretty quickly with patients that are engaging with physical activity at those times of the year, and more importantly, this year coming out of the pandemic.
Our guest today is Dr. Warren Bodine, Director of Sports Medicine at GLFHC. So I want to step back for a second and ask you about the pandemic. Are we seeing more or less people coming in with sports medicine injuries now that the pandemic is over because they decided, I'm not going to the gym because of the pandemic, but I'm going to, get an exercise bike or a rowing machine, and I'm going to, work out at home, and not maybe seeing their trainer or what have you? Are you seeing more or less people as a result of the pandemic?
Loaded question. I mean, in my practice, I would say it's been about the same. Not as many patients in my practice have the opportunity or the financial resources to engage in physical activity at a gym and personal trainer. So I don't see as many patients then pivoting and having as many injuries like that at home. What I have seen, though, is delays of care. So patients that have waited to come in, waited to engage with the healthcare system. And at the early stage of the pandemic, as our health center, like many others, really converted to telehealth as a primary means of providing care across their panel of patients. And it's really difficult to deliver musculoskeletal care over video and over the phone. So it has provided an opportunity to reinvent the way even I perform my interviews and ask my questions of patients to make sure I'm getting a full understanding of where they are with their injury, what their deficits are, and how I can best help them.
We're talking with Dr. Warren Bodine, Director of Sports Medicine at GLFHC. We're going to take a quick time out. When we come back, I'm going to ask a silly question about the Olympics coming up here on Pulse on Health. Welcome back to Pulse on Health. I'm your host, Mark LeMay. Our guest today, Dr. Warren Bodine, Director of Sports Medicine at GLFHC. All right, I'm sort of hooked on the Olympics because they were put off by a year, and I'm watching some of the trials. And I see athletes with these long strips of tape on their arms and legs. What is that?
Great question. So I think this the movement of this started at a previous Olympics. I believe it was the one that was hosted in Australia a couple of years back. That particular modality is called kinesiotape. So it's a form of support that a lot of athletes will use to not only help prevent injury, but also to help recover from injury. So what I mean by that is it will help a patient recover from injury because it's essentially providing increased lymphatic flow to the area that may be injured. And what it does it by traction, essentially. So it's really expensive athletic tape to really get to the take home point here. It's really expensive athletic tape that's effective, but like anything else, you wouldn't put tape to hold a door up on a hinge. So over time, that tape's going to give up. Given the stressors of what athletics and athletes have to endure between heat, humidity, sweat, even the best tape, even kinesiotape, will lose its effectiveness pretty quickly. So hopefully that answers that question. It's definitely a fad. It's something I see or I get asked about it very frequently with my high school athletes about getting access to it. And I usually give them the same spiel I just answered here on the show, is that it's really expensive tape, and you can get similar effectiveness from plain old athletic tape at your local CVS, Walgreens, drugstore, or sporting goods store.
Well, so is the old ACE bandage gone by the wayside?
I don't think it's gone by the wayside. I think it's another modality that athletes and patients can utilize to help them recover from their injury. I will spend time to time whenever I'm in a CVS, Walgreens, drugstore, just going down that aisle to see what's new on the market, what's out there. And of recent memory, there's more of an uptick of availability for what we call trans-electrical cutaneous nerve stimulators, or TENS units. These are the little units that put little electrodes around the area where you have your musculoskeletal pain or your injury, and essentially delivers an electrical impulse to bring more blood flow to the area and help stimulate recovery.
Should that be done without the advice of a physician?
No. But, like most things in the consumer world, they do put some protective measures in place. So if someone were to put it on their body and really drive it up to a high level of electrical stimulation, they would feel a lot of pain before they would cause damage to themselves.
Okay.
And there's a lot of warnings on there not to put it over sensitive areas of the body. A big one being the frontal chest area where your heart lives. Probably not a good idea to voluntarily deliver an electrical impulse to that area of your body.
I need an answer to this age-old question: heat or cold to an injury?
So for an acute injury, cold, decrease the blood flow and help stimulate recovery. For a more chronic issue, if you're feeling stiff or you're, a couple of days or a week into an injury, I would probably rely more on heat to help loosen things up. But cold acutely, heat for subacute or more chronic types of issues.
Sports medicine isn't just about fixing a broken down body part. It's also a mental health issue. So many people become depressed after an injury or treatment for an injury. Let's talk about that aspect of it for a moment.
Yeah, of course. I mean, I think what the beauty of being a sports medicine physician, you see folks at different stages of their life. You're seeing folks as they're celebrating some sort of achievement that they were looking to do, whether it be a marathon, and I cover the Boston Marathon every year with the team from our health center. So to see some folks come across that finish line and almost collapse, but have a big smile on their face is one of those kind of, bucket moments where people say, you know what, I achieved something. I'm really happy. I was able to put all this time, effort, energy. I had the support of my friends, family, and everyone to help me get literally across the finish line. And then you have the folks that are on the other end of the spectrum that suffer an injury and maybe not be able to participate in the activity that I just mentioned, something they're training for, like a marathon, or what you're seeing play out right now on TV in the evening, which is the Olympic trials, right? You're seeing these athletes who have trained so hard to get a spot on a team, And you have folks that, a quote this week came out from Usain Bolt from Jamaica, one of the Jamaican sprinters. He came out with a really nice quote that said, I trained for 4 years for 8 seconds, of time. And I think if you think about that perspective, it's pretty, eye-opening, right? We think about a lot of things. You have a lot of disappointments in life. And injuries are one of them. And I think what's unique about sports medicine is you're able to see both ends of that spectrum and really be there for the patient and help guide them through that process, guide them through the despair that they have initially from the injury, and then guide them through the process and really be able to give them informed decisions and steps along the way of saying, this is what the recovery looks like. This is what your time frame looks like. And then being for them on the other side of that when they're able to return back to their activity that they love.
One of your passions is sports medicine on the high school and college level. You're a sideline doc at pretty much every high school game.
Seems like it, right?
Pretty much. Either that or the health center has someone, from the sports medicine program at most of the area football games. How does treating a high school or college athlete differ than treating someone in their 30s, their 40s, or dare I say 50s and 60s?
Yeah, I mean, I think it's all about perspective, right? Student athletes, and I say that intentionally, are students first. Even if they're the best player in the state, country, league, whatever you want to use as your audience, at the end of the day, they're still students first. And a lot of these athletes are kids as well. So there's a lot in play when you're dealing with a student athlete. And, as it pertains to an injury, making sure they get back to their previous activity level, but also making sure from an academic perspective that they're able to achieve their goals as well. Because as much as, those athletes feel like they're going to be the next superstar, we know statistically that's not going to be the case. So we have to look at those athletes through the lens of what their the whole lifespan is going to look like and what they're actually going to probably be doing for the rest of their life. So they're probably going to be a student. They're probably going to move on to different forms of education, secondary education, maybe college. And, this really pertains more to concussion management. But even for the musculoskeletal injuries, it's really important to put that into perspective because a lot of those athletes aren't going to have a full-time career of being an athlete always.
And from a physical perspective, does it matter that the younger body is still developing that might concern you about injuries to a youth player versus an older player?
Yeah, of course. Specifically, a big thing that comes to mind is youth baseball. So we think about Little League baseball. We think about the developing arm for those athletes and specifically their elbows. For anyone that follows baseball, the most catastrophic injury you can hear about from a pitcher is a UCL injury or ulnar collateral ligament injury, which results in Tommy John surgery. And the recovery from that is pretty long. And if you just think of the biomechanics of a pitcher, a lot of force and torque is put through the elbow. And it's really important that when we're training younger athletes to come up through the ranks, that's also an area of high stress for a growth plate. And we do see very frequently catastrophic injuries because student athletes and coaches and some of those little league organizations aren't following the recommendations from the overarching medical society to talk about pitch counts and making sure people are taken out at a certain time. Even the framework and the methodology of thinking about pitch counts is pretty new in baseball for professional baseball. You hear about that, very frequently, especially in the playoffs. You'll hear about, all right, we can only do this many pitches for this guy because, either they're recovering from an injury or we're protecting them from an injury. And there's a lot on the line, obviously, for professional sports. There's a lot of money on the line. There's a lot of, obviously energy for those clubs and organizations to win. And that all starts when they're younger. So I know I specifically talked more about elbows for pitchers, but this, obviously, applies to all other sports as well. So this is why, very frequently in the sports medicine world, We talk about early sports specialization actually being detrimental to an athlete because it's constant stress and strain on a particular body part. And in a growing athlete, as we know, there are open growth plates. And when things are open and there's essentially it's a crack in the bone, essentially, when things are open, it lends itself to further injury and potential disability down the line.
Concussion awareness is a passion of yours, and it's really taken center stage in high school sports, I'd say over the past 10 years or so. So much so, athletic associations like the MIAA are taking on new rules when it comes to sports like football and soccer. Your thoughts?
Yeah, I mean, it's a great question. I mean, I think we're starting to see more emerging scientific evidence about the long-term effects of concussion. Again, I even think back when I played sports 15, 20 years ago, and maybe even yourself, Mark, maybe growing up around sports, it wasn't a concussion unless you were knocked out cold, right? Unless you lost consciousness, it wasn't considered a concussion. Get up, get back out there, use smelling salts, get some way to get that athlete back out there and stumbling on out there. And we realize that that's probably not good for anyone, but more importantly, not good for the brain in general. And it's really important. So it has taken center stage, and I think it's gotten the level of attention that it deserves. And the issue, though, with anything else that's a new or emergingly or changing types of evidence is that you have to have everyone catch up to it. So very frequently, most of my day-to-day, when I deal with a student athlete with a concussion, I'm usually not fighting with the coach or fighting with the athletic trainer or even the rest of that healthcare team. It's usually maybe the teacher that doesn't believe that kid has an injury, so we're still going to make them do all the assignments because they look fine. Maybe it's the parent that was maybe a high school athlete back in the day and says, well, my kid looks okay. Maybe they're a little off, but they should be able to do their same level of activity. And what we realized with a concussion is that we treat it like every other musculoskeletal injury. We treat it with a graduated return to play. So we increase layers of stress and complexity with each stage of the rehabilitation process. So for example, if you sprained your ankle today, Mark, tomorrow I wouldn't expect you to be running 100-meter sprints down the track. If you were being chased by a leopard, perhaps you'd be able to muster up the energy to do it, but it wouldn't be ideal. Much is the same for concussions. If I had a concussion today, I shouldn't be returning to full game activity tomorrow. I shouldn't be returning to my same level of cognitive activity or my expected cognitive activity tomorrow. And for me as a physician, that's a lot of things I have to deal with. I have to deal with the patient that's talking to me. I have to deal with the computer, the electronic medical record, a lot of other members of my team. So it's important to realize there are a lot of other stress points that may come into your patients, into their life that you have to really consider when you're developing their return to play, return to work protocol.
I have to say, concussion awareness, concussions in general, could be a topic for an entire show, because we're short on time at this point. But what are the signs of a concussion? Can it just be one hit? Can you get a concussion from not a sports injury? There are just so many other questions that we could ask. We could do an entire show just on concussions. So.
Yeah,
maybe there's an idea for another show for you and I.
Hey, sounds like a great time. I'd look forward to that and welcome the opportunity.
Thanks, Doc, for joining me on this edition of Pulse on Health. I really appreciate it.
Anytime, Mark. Thank you so much.
Just a reminder, you can hear all of our podcasts via our website at glfhc.org. Just click on the link about halfway down the main page. Until next week, I'm Mark LeMay. Have a healthy week, everyone.